Hey everybody, my name is Lilly Spayde. Today my presentation will focus on the case studies revolving nonprofit turnover crisis. So to get started, I kind of wanted to identify some of the biggest HR issues. Obviously, the high staff turnover in these nonprofit organizations is a huge issue within this community. Many nonprofits report an annual turnover rate of almost 19 to 30%. Obviously, these sectors of organizations and nonprofits rely heavily on emotional labor, low wages, and overextended staff. Most people that work for these nonprofits are doing it out of the goodness of their own hearts, which is a big issue revolving the turnover in nonprofit organizations. One of the biggest reasons being staff burnout and mission drift contribute to retention struggles. So some of these biggest examples of these organizations would be Planned Parenthood, the Red Cross, Habitat for Humanity, and all reporting HR strain due to turnover. While it may not seem that the consequences of a high turnover rate would be a big deal, as it seems like everybody's always looking for a new job, the consequences of this are huge. One of the first being disrupted program delivery. This will cause delays in services along with client inconsistency. One of the biggest being low morale within the organization. So this will cause the remaining staff to feel overburdened and overworked, and this causes burnout to spread. Another big one that happens a lot within nonprofits is the rising operational costs. So the average cost per new hire is about $4,000 to $6,000, which may be hard for a nonprofit organization to fix. Another one would just be pure dysfunction. So the more that they leave, the harder it is to retain others. So within this chart, you are kind of able to see the historical versus the current status of these high turnover rates. So starting in the early 2000s, the trend seems to be stable but under-monitored turnover, with examples of limited HR departments in these small organizations. During the recession of 2008 to 2015, it seems that budget cuts and downsizing and retention drops were some of the biggest trends, with examples of widespread burnout. Retention was not a focus. During COVID, 2020 to 2024, it seems that the trend followed a major spike in resignations along with mental health issues, which probably would have stemmed from working from home and loss of contact with coworkers. Examples would be hybrid work, increased need for flexibility. One of the most important things to identify in this high turnover rate would be the stakeholders that are impacted and involved. So one of the big first ones would be the actual employees. So this leads to job insecurity, overwork, burnout, leading into managers and HR teams, which means constant recruitment and unstable teams. It is hard to maintain confidence in your team when you are constantly getting new hires and people leaving. Another one would be the funders and the donors, which are concerned about instability affecting outcomes and possible donation issues. And another big one, the main point of nonprofits would be community served. So this would lead to inconsistent access to programs and in support within the community. Another factor to look at when trying to understand these high turnover rates would be the social and economic context of the situation. So nonprofit staff often work serving marginalized groups. This can cause emotional burden, especially for those who are working on the front line with domestic violence victims, youth programs, and drug abuse programs. There also seems to be a large stigma around mental health, especially in these smaller organizations. Something that's extremely important to look at is the economic context. Obviously, one of the biggest reasons for turnover would be the fact that the sector pays 30% less on average than for-profit roles. So some of these individuals who are working in nonprofits are working frontline, doing the hard, heavy, gritty work, and they are making significantly less than the private or public sector. Smaller organizations also lack heavy and most correct HR, so it's harder to go through these organizations and kind of have a base. There is also increased turnover that leads to costly training, onboarding, and a significant amount of knowledge loss. So this graphic kind of shows you what are the largest contributing factors to turnover, with the first one being obviously inadequate pay and benefits, leading to poor organizational culture and leadership, lack of growth and career mobility, poor work-life balance and burnout, and one of the most important, which is the absence of the clear HR policies. So an example would be that in 2023 nonprofit HR survey, 45% of staff cited that there was a lack of upward mobility, and this was a number one top reason for leaving. So while obviously it is a lot easier said than done, I do believe that a couple policy recommendations can significantly help the problem. Starting with competitive compensation policies, benchmark wages, along with providing cost of living wage increases, mental health and wellness programs such as regular check-ins, mental health days, counseling. I believe this is extremely important, especially for those working in nonprofit. You are usually working with heavy and a lot of emotional turmoil, such as domestic violence victims, youth programs. So I believe that it's really important to stay checked in and have mental health days. Another one would be internal career development, so skill-based training, promotions, mentoring, feeling like you have growth in the program. Another one would be transparent feedback channels, obviously engagement surveys and having an open door for communication all the way through HR. With these policy recommendations, I believe that there could be some great projected outcomes, such as reduced turnover and hiring costs, increased employee satisfaction and team cohesion, greater program consistency and improved client outcomes, along with stronger organizational reputation and donor confidence. So throughout my research and understanding the case study behind this high turnover rate, I believe that high turnover rates undermine nonprofit missions and outcomes and causes are systematic and require a big internal and intentional HR policy shift, and a people's first approach would be essential for keeping the team together and in cohesion. Obviously, this is just my references, but I wanted to say thank you for listening. I believe that this is an important issue that needs to be looked at and obviously needs to be fixed. So I'm looking forward to your critiques, and thank you.